Did you recently bonk your head and you're worried you have a concussion? Here's the top 4 ways you can tell that you had a concussion. You're foggy headed or you feel dazed. You have constant and persistent nausea. One of your pupils is bigger on one side versus the other. You have a constant headache and you feel like your brain is jello. If you had these 4 symptoms, the first thing you should do is get cleared out by a medical doctor. Make sure you have an MRI, that you don't have a brain bleed, there's no fracture, and there's no other extenuating medical circumstances. Now, once you've been cleared and there's nothing life-threatening going on, there's many things that you can do to help your body heal, because it's going to need to. But I want to talk about 2 things quickly. When you have a blunt trauma strong enough to shear brain tissue and cause a concussion, simultaneously the top vertebra in the neck and a couple of the other lower ones also can be involved. But that trauma can cause a structural disrelationship in the skull, or the skull, head, or neck region. We have seen hundreds of concussion cases post-concussion. They usually get to me 6 months to 3 to 5 years later, and they're suffering with chronic headaches, chronic cognitive problems, vestibular issues, balance issues, sleep trouble, chronic neck pain. And I'm trying to have you avoid the things that can happen down the road if you don't do the appropriate things. So if you've had a concussion, you've been cleared out medically, you're still suffering with things, what you need to do is get to an upper cervical chiropractor and get checked out in the upper cervical spine to find out if one of the upper neck vertebrae is structurally locked, because if it is, it's irritating the central nervous system, and you don't want to heal up in that bad position, because it will continually irritate and interfere with the brainstem and the central nervous system's ability to adapt and function the way that it was intended to, and that can lead to chronic health issues down the road. Now, if you're someone that's gotten to this video and you're one of these people that I'm talking about, and you had a trauma 6 months, a year, or 3 years ago, and you're having all these chronic issues, and you've done the fish oil and you've been to the massage therapist and had myofascial release, red light therapy, hyperbaric oxygen treatment. If you've done all those things and you're still stuck with chronic issues, most likely it's this upper neck thing. So hope this video comes across people who are dealing with a fresh concussion, so you can avoid what post-concussion people generally deal with long term. And if you're a post-concussion person who's found this video and you're currently 6 months or several years out and you're dealing with these problems, now you know one thing that you can investigate, and that's upper cervical chiropractic.